I am Gio, your host for Ask an ECV Expert today. I am joined with Tiffany James and Joaquín Beltrán, both of whom are part of our outreach operation to try and push for changes in policy and to reach out to local communities and governments to give them resources so that they can help save lives. Uh, So I think would probably be a good place to start by just saying that outreach is easy. This I think is true, but it's also kind of it's an important idea to get across that this is not a difficult thing that we're trying to do. You just basically have to make phone calls. And you have to be a human person, and you have to do it day in and day out, and you'll see progress. Every time that we've had somebody who just does it for their local community and just works on it, we see success. So I think that's a good place to start. And so Tiffany, you have joined us now for a month, 2 months from South Carolina. You are on mute, by the way, so just unmute yourself real quick. Yeah,
Sorry.
so tell us a little bit about how you found ECV and like your kind of immediate thoughts of like doing outreach for ECV, maybe in contrast to political outreach, because that's where you usually do your work, correct?
Yes. Thank you for having me here. I love to share my experience and also learn from others too. So, but yes, my background is in political organizing. I worked for Mayor Pete Buttigieg and a lot of different issue campaigns in the past. But I was working on COVID response with DHEC before I was with ECV. And I'm still kind of working with them. If they have information they need to be, distributed to the community, they, email me or ask me to come by and pick up materials or what have you. So, but they aren't really doing much. They're a government. DHEC is a Department of Health and Environmental Control here in South Carolina. They're a governmental agency, and so they have to take the lead of the governor and whatever he decides. So really all they were doing was playing the role of an information service. Just here's information on COVID. But I felt like there was something needed and didn't know exactly how to tap into what was missing. And then a friend of mine, he's friends with Ben. I'm not sure if you all are, Ben Lazarus. I'm not sure if you all know him, but he worked with ECV in Virginia. He's now in Prague. He just got sent over there as a diplomat. But about in May, he reached out to my friend Chris and asked him if he knew anybody that does like grassroots work. And he said, yeah, my friend Tiffany is, I know she's doing COVID response with DHEC here in South Carolina. She works with civil rights organizations. She's done political organizing. I can connect you with her. And so he did. And then the rest was history. What I was looking for, I found in ECV. Basically just the tools that we need to empower our community to take action ourselves. So that's how I got involved, and I'm just so happy to be here.
All right, thank you. Yeah, Ben
Did I answer?
Lazarus. Yeah, you get a good start. We'll have more questions. Don't worry. So Ben Lazarus had some success just writing an open letter and getting local community leaders and scientists to sign it in Virginia, and that got all the way to the governor, I believe, or at least I'm not sure on all the details, but it got quite a bit of attention. Newspapers picked it up, and so it's kind of about doing something versus nothing, not doing something spectacular versus doing something mediocre. Like the outreach is very much about just getting stuff done. And so that's kind of the point about easy. Joaquin, you have been on our team for quite a while and have helped out with quite a few things, especially your Go Speak Up America applet that makes the whole process of being part of the political outreach team even easier. So why don't you tell us a little bit about yourself, how you got involved with ECV, and the rest of it.
Yeah, great. Thank you so much, Gio. My name is Joaquín Beltrán. I'm really happy to be working with end coronavirus and to be working with amazing people like Tiffany, like Ben Lazarus in Virginia, like Briggs Klinko in Arizona. So many people doing important work on the ground. Just provide some of my background. I hope my video is okay. I know you.
It works, yeah.
Cool. So my background, when I started getting involved in community work and advocacy was on the Obama campaign in 2008. I worked as a volunteer recruiter in the state of Nevada. I went there because it's a battleground state. Battleground states matter, right? You know, it turned out that, you know, I was really good at it and I loved it, you know? And so after that, I kept trying to be involved. So I got involved in advocacy and higher education on my campus. Ended up working on advocacy for the state of California, for the California State University system there, or here rather. And then after that, I worked with, and during that time, there was another crisis, which was the Great Recession, right? So tuition went up by a third for many students, hit them really hard. After that, I got involved in economic development with the SBA program, Small Business Development Centers. And so they help small businesses grow. And so I helped them create their advocacy strategy. And so they didn't have one in place, so they hired me on to create that for them in order to make sure that they got enough funding to keep supporting small business owners. And then after that, I joined the Choral Foundation as a Choral Fellow. And what this is, it's a fellowship in public affairs. So they place you in a media company, a labor organization, a nonprofit, a foundation, a government agency, a political campaign, and a business. And the idea is to immerse you in the different aspects of a community and understand the complexities and how they all work together to create change. And so after that, you know, I saw how hard it is to create change. So I know you said, you know, outreach is easy, but really community organizing is very hard. You know, it's a lot of work. And part of that is because the political process is very difficult to get things done in, right? And so I experienced this and I saw how technology companies were creating change at scale. And so, so I decided to learn how to build software in order to create that change at scale. So you mentioned Speak Up America. So I built Speak Up America as a bridge to the advocacy work and creating change at scale. And so what it does is it helps people connect directly with their legislative representatives. I've helped include it with endcoronavirus.org's advocacy work so that people can receive a text message to help them on the call in order to help grow green zones. We have it available for governors, for mayors, for Congress. And I've added just recently to support the great work that Tiffany is doing in South Carolina for state legislators as well. So for both houses there, the state reps and the it's state reps and state senators. Yeah, and so so with that, you know, part of my purpose, I feel, at endcoronavirus.org has been to really empower others to help them be effective in their communities, right? So just, trying to, take the lessons I've learned in community organizing and advocacy, and help to empower the individuals here who are trying to create this change in their communities, right? To have green zones, to have better testing with CT scans, right? To have isolation housing. So I'm really happy to be here and, help in whatever other way I can.
Yeah, hard and easy here might be the wrong language. I think the idea I wanted to express is that this is accessible. Like, participating in outreach is very accessible. We at ECV have done some of the hard work to make it more accessible. Like your Go Speak Up America makes it like having impactful advocacy and having what you need to actually reach the political leadership local to you in your community or state, as simple as pulling up a website, making a phone call, following the script there that's specific to the purpose that you want to make. This makes it very accessible to people. Now, actual change is a hard slog, but a dedicated person who works on it day in and day out will be able to make progress on this. And we've seen that multiple times. And so that's what I mean by easy. It's not like a select few that have like access to make a difference. It's available to all of us. And it is part of our sort of political right as Americans to participate in this. So that is my sense of easy. I get you 100% that it is kind of a task to take on, and it is a bit of a slog. So it's both hard and easy at the same time.
Yeah, but to your point, the ECV team has been working hard to provide as many resources so that people can, hit the ground running, right? And do the work that it takes in order to eventually create this change.
Yes. So, kind of with a bit of like who you guys are out of the way, I think the place to go next is going to be perhaps Joaquín, your advocacy training, which has been recorded and is up on YouTube, and it's kind of a how-to guide for pushing this kind of stuff up to the right, say, political figures, and to get through to change. So I've linked the link to the training video recording in the chat, and it will be available on the recording of this video when we put it up. But why don't you tell us a bit about that video so that we have an idea of how to approach it, perhaps?
Sure. Yeah, happy to do that. So the video focuses on the advocacy aspect, right? So, okay, right. So when you're thinking about community organizing, you have the outcome you want, right? And in order to do that, there's a lot of steps in between, the outcome you want and the next step to getting there. And so, community organizing, there's different parts of that. Some of it is, knowledge, information sharing. Some of it is, coalition building. Some of it is the legislative work. Some of it is just like, are you creating initiatives in your community? So the advocacy training focused more on the legislative part. And, hey, if you have a goal of, for example, adding CT scans as part of the testing, right? And you want to work with, your governor or your mayor, for example, on that. Then how do you go about that, right? So I provide some of the steps in order to, set up a meeting. Also, during the meeting, what's the agenda look like, right? Some takeaways you also want from the meeting as well. So, some of the takeaways are, as I'm remembering, are, making sure you listen and you understand, what's currently going on. That's a big part, I think, of just any part of community organizing, is really understanding what's going on and listening and asking questions. The other part is just, introducing what ECV is working on, making sure that they know what our goals are, and in that process, listening and the work that ECV is doing, it's sort of like a puzzle, right? So you kind of fit it where it works there, right? This is pretty much finding common ground. And then, the last takeaway there is, some next steps, right? When's the next meeting? Are there any follow-up items? And so, and so the training just kind of breaks down how the advocacy process works, a little introduction about government and government structure and politics, a little information about, again, what is change? There's a lot of different ways to create change. Advocacy is just one of the ways, but it's an important part in the work we're doing right now, right? And so, but, part of all of that is just, making sure that whatever your next steps are, that you follow up on it, that you follow through with it, because it's a lot of work you're doing, right? And sometimes if you're, so it's kind of a balance, right? If you take on too much, you can let things fall through the cracks, and then there's no carry on, right? And so what you have to make sure to do is, if you said you're going to do something, when you're supposed to follow up, that you make sure to do it. This is really a momentum type of thing, right? You keep building, you build, and there's going to be a lot of challenges and obstacles, but that's okay. That's part of the process, So a lot of this is just problem solving, but making sure you follow up is an important part of that process. And keep going.
All right, thanks, Joaquín. Tiffany, I guess maybe you could run down a bit of like what a day-to-day might look like. This is your day-to-day.
Can you, oh, I'm sorry, you were breaking up a little bit. You said run down my day-to-day activities.
Yeah, what does the day-to-day of
Yes.
advocacy and political outreach look like, to give a bit of texture and flavor to all of us watching who've maybe not participated yet but are thinking about it? Like, what would taking on a bit of local outreach look like as like an experience? Yeah, go ahead.
Right. Well, right now during the pandemic is a little bit different because you can't do a lot of face-to-face things. But it's a lot of phone calls right now. So my day-to-day is contacting people that I have relationships with, just contacting people in my network, and delivering them the message of ECV, and trying to get them on board. Like, coalition building is pretty much my day-to-day, trying to see what organizations could be a part of what we're doing, what churches can be a part of what we're doing, what businesses can be a part of what we're doing. So my day-to-day is pretty much phone calls, talking to people about what we're doing, and not just about what we're doing, but
I think Tiffany cut out a little bit.
Yeah, we had a lag issue there, Tiffany, for like the past 10 seconds. And you're on mute, so you want to check that. Sorry about that, everybody.
No, I'm sorry about that, y'all. So my internet is going in and out, so I do apologize for that. But I don't know everything that you all heard, but my day-to-day looks like a bunch of phone calls right now because the pandemic has, kept people away from each other, as you all know. So on a regular day-to-day life, if it wasn't for the pandemic and like during like my political organizing, it was a lot of face-to-face conversations, getting to know people, connecting with people. That is like the primary thing when you're trying to do coalition building and rallying people behind your cause, is connecting with them through values, just talking about like what values your organization stands for, and connecting it with them, and then just communicating your message, what you're doing in your organization, and how you would like for them to be involved, and how your messages or how your initiatives intersect with each other. More than likely, organizations are more likely to get on board if they're already doing something that connects with your goals, right? So it's about connection, about communicating with people in order to get them to be on board with our cause. So basically, it's coalition building, and so it's talking to people all day. Talking to people all day, and emailing people, and basically yeah, I mean, it's like calling people and emailing people all day right now during the pandemic. So yeah. And
Yeah.
I mean, it's just coalition building, and those are the tasks that I do to build our, not just our brand, but to build our team here across the state of South Carolina. And I guess I can give some examples. I guess, like, for example, like today, I met with, I probably shouldn't have, I met with the superintendent of one of the school districts here. And I met with him because the teachers in South Carolina are having, basically, they're having a week of action, and it's called Virtual Until Safe. So they're basically saying, hey, we don't want to go back to school until it's safe. And so I saw an opportunity to connect with them in order to get them to be behind our cause with ECV. And so what I did was called up one of the organizers. They told me about what they were doing, and I went out to their rally today. And while I was at the rally, I was showing my support, which is a part of coalition building. And I was also networking and connecting with other people who are out there. So because I went out there, I was able to connect with the school superintendent who wants Yanir on his next Zoom call. So it's basically like coalition building is gives you an opportunity to network and connect with other people in order to continue what you're doing, continue your brand and what you're doing. So
All right.
Yeah.
Thanks, Tiffany. The concreteness, I think, is really important to make this more accessible. Kind of, I was thinking, as you're describing business leaders, one way to approach it locally might be for someone to look up, just, type in their city on the browser, look up restaurants and like mask policies, and, just go through a list of maybe their favorite restaurants, right? It doesn't have to be all restaurants. It could just be your favorite restaurant, something that's really graspable for you personally, and see what some of the businesses are doing to keep their employees and their customers safe. And if you see one of the businesses that you like, your favorite food places, that doesn't have like a full policy, you could call them up and tell them, hey, these are some policy things that work. And that itself is just as much advocacy as anything else. And that's like, if people do stuff like this, that's how you just build this momentum that you guys are talking about. Because then, you know, you're talking with the business guy and he's like, oh, that's a great idea. I didn't think of that. This was difficult to solve for us because of these things about the way that we work, but now we've got the solution that we didn't think of. And, you know, now we're better, we're safer. And now I'm going to share this with, you know, one of these other businesses that, you know, I either own or a friend of mine owns, and then it propagates like that. And then it's like, hey, what more can you do to help us? And then all of a sudden you've got a relationship that's both ways. And that's the kind of growth.
Yes, absolutely. You just explained something that happened with businesses here in South Carolina, as if you were here. So yeah, no, I have a friend who owns a business in Columbia, South Carolina, and I went to do a pickup to go order. And he was telling me about his concerns with his staff, how, you know, he didn't feel like they had much guidance with, you know, what to do with opening and reopening. And so I said, hey, we have, you know, a group of consultants who can help. They have the answers for you. And if you can connect me with other restaurant owners, I can definitely connect you with, you know, some scientists and professionals who know, you know, who has the answers. And so he connected me with this organization called Safe Dining SC, and it's a coalition of restaurants across the state in Charleston, Greenville, and Columbia, like the three largest cities in South Carolina. And I spoke with the founder of Safe Dining SC, and he basically echoed the same concerns that my friend had with his restaurant. And he said the restaurants are having a hard time. We would love advice. So I was able to connect them with Gary and with Jeremy and on a Zoom call. And so the restaurant owners were able to connect with our consultants, and they were just thrilled to have guidance. To this day, they are just very appreciative of what we've done. They even went to the news station and said, hey, the National Scientists Volunteer Database in coronavirus supported us when we didn't have, you know, the guidance and the tools that we needed to reopen or not reopen. So Gary is on the call. So Gary was a huge part of that, and it went very well. And actually, I spoke with the Safe Dining SC founder today. Well, not today, yesterday, and he would like to do that again, just to have the restaurant owners come back and raise up other issues that they've had since they've reopened. So yeah.
That's fantastic. That's what a success looks like, right there. Is it's not it's a small step in your local community that just gives people tools, and it's kind of we have the answers, we have the knowledge here within our organization that's needed in many parts of the world, like globally, that's needed locally in your community. And the issue is that there's so much signal noise. There is so much communication barriers. There's so much in politics right now that's very dysfunctional. And, you know, it's not great as a baseline. One of the anecdotes that I heard several times early on in this process that I imagine may still be an issue is that mayors of large cities in states could not get in touch with the governors of their states because there was just so much communication traffic that nobody could get through. Nobody, like, you know, mayors of cities with millions of people in those cities could not get in touch with the governors of their states. And I think that is the kind of thing that when you know something like that, like a small phone call that helps get knowledge through to somebody who can use that knowledge, which is usually someone local, which is usually somebody you know of, you've interacted with before, like your favorite food joint. You probably know the owner by name, right? Maybe you eat someplace like once a week, they know who you are, you're one of their regular customers. You come to them and be like, hey, we can like help make this safer. They'll be like, yes, this is great. I want to be safer for my customers. I want my customers to return. I care about my customers and I care about my employees. That's like real change and progress. Joaquín, so
Yeah.
what are some of the things that you have seen? This is a question from Derek in the chat. How do you actually get people to commit to joining in and helping with advocacy work? Do you just ask tons of people, assuming most will say no? Maybe just give them small tasks to start. So what have you seen that drives engagement?
So I'll build on what Tiffany and you were mentioning right before this to answer that question and build off it too. And that is that, you're going to talk to a lot of people and you're going to get no's in some places where you thought you were going to get yeses. And you're going to get yeses in some place where you thought you were not going to get any response. And that's just how it works. And that's really surprising. This is one thing I've experienced, at least for the last 10 years, as I've been active on this, a little over that. And you'll find that some people, maybe complete strangers, are so gung-ho and they're going to do so much work and make such an impact. And that for me, that's one of the most inspiring things working in community organizing. When you just come across someone where something resonates and they're all in, and you're like, whoa, I don't even know you, but you're dedicated to the cause and you're putting in a lot of work. And sometimes there's people you may have in mind that are like, oh man, like I have this great connection, right? So, sometimes we overvalue networking. Networking is good, but it's just like, it's kind of like your network is just, it's the people and sometimes, people help each other in different ways. But that's what it is, right? And sometimes, what you're working on does not resonate with someone that, and may, have a great title or whatever, and you thought, hey, like I would have thought this person, would be all on board, right? But that's okay. This is, it's important to recognize that this is part of that process, right? And so, to Derek's question, how do you get people to commit? How do you get people to join? Honestly, it's just a process of asking people, different people, don't pick one target and then think that's your only person that you want to bring on, right? You have to think beyond that person, right? So think beyond that person. Think about your family, your friends, strangers. Put this out on social media, right? Like cast a wide net and cast it over and over and over again, right? And then the people who are going to do work, you don't have to work too hard to get them to do work, okay? Because the people who are going to do work, they want to do work, right? But sometimes these people don't even know that work is being done, and so, by this is part of what we're doing, right? So, we put out content, we do virtual, Zooms. Tiffany has been great at doing a lot of Zooms in South Carolina, which has been amazing and bringing a lot of people and growing that community support there. And that's how you do it, So there's no trick to being like, hey, I'm going to get this person to do some work, right? There's no trick other than, one thing I would say is if someone's interested, don't give them this overwhelming task unless they're good. Some people are just good at these overwhelming tasks and they're like, I'll figure it out, whatever, but most people, they have to fill it out, maybe, there's something, it really has to resonate with what they're interested in, what they want to do, one way to do it is just to invite them to the things we're doing and just kind of feel their way through it and see what resonates with them. And then they'll take initiative as well, you know? So it all kind of depends. But, you know, how do you get people to participate, do great work? You just put yourself out there, share what you're working on, keep doing that over and over again. And eventually people will see that, and then people will want to participate in that.
Thanks. Fantastic.
Can I just piggyback?
Go ahead.
Yeah. So I just wanted to just to add on to what Joaquín was saying and to what I was saying earlier. There's no trick to this. There's no trick to getting people to commit and to be involved. One thing I like to do is to show up for people. So just like I said, I showed up for SC for Ed, which is the teacher organization. That's a group of about 15,000 teachers. So if we get them on board, then we'll have a great coalition, right? And then also the National Domestic Workers Alliance organization, they contacted me about like a drive-in protest that they did a month ago. I showed up, not just because I believed in their cause, but I knew that they would be a great ally for what we're doing. So, and they are, and so they are interested in being involved with in coronavirus. So it's just, for me, it's kind of like I've seen people like get more involved with what I'm doing whenever I show up for them. And it's about it's about just community connection and shared responsibilities. Like we're all in this together, right? It's about the whole message of we're all in this together, like Yanir always preaches. So, so yeah, it's give and take.
Mm-hmm.
So one of the things that one thing is ask questions. We have Tiffany for about another 20 minutes. So if you want an opportunity to pick her brain, this is it.
Brain.
One question that I think is a good frame is back to the information flow bit of this, that there are lots of communities that don't have good information about COVID, and that might be one of the reasons why people in that community that you don't expect to respond so powerfully, because they're looking for something to do, but their information network does not support them with the kind of knowledge that can be leveraged for action. And so, Joaquin, I know you've done some work with the Spanish-speaking world in LA to give them some knowledge resources. And Tiffany, I'm sure that you work in South Carolina with impoverished communities that don't have a lot of resources to be able to find ways to solve their problems. So I would like to get a bit on both of that from you, but with awareness of the time that we have left with Tiffany to get some of the questions in the chat.
Right. Well, I think with information sharing, you have to know your audience first. So South Carolina is primarily rural. We have a couple, large cities, but they're not even large cities, right? They're just known cities. And but it's mostly rural, so it's about what reaches rural areas. And usually it's radio. Radio reaches rural areas. There's not, broadband is not, widespread throughout our state. So we have a lot of areas that don't have access to broadband. And so social media is not the best tools to get to rural areas. So in order to reach everyone, radio is probably the best thing because everybody listens to the radio, especially the more rural you are, the more you're listening to the radio, because that's almost your only source of information, that and mail, right? So so I know with campaigns, we were pushing mailers. We had to get mailers out because we know that that was going to reach everyone. Social media wasn't going to reach everyone, but the mailers and the radio ads, that was like key to reaching most people in South Carolina. And then we talk about the elderly community, the same with elderly community. So some elderly people who are even in the urban areas, they listen to what they know. They listen to the radio, the TV. They're not on social media. So I think it's about, you know, who you're targeting. And when it comes to the work that we're doing, we're targeting everyone, right? So we got to get our message out to all the channels. I've done a radio show to talk about in coronavirus and what we're doing. I've been on the news. So local TV, so to talk about what we're doing. And so the last show I was on was last week, and I had people call me and say, hey, I saw you on, you know, Cynthia Hardy is the name of the show here in in the Midlands. We call it the mid areas of South Carolina. And so it's like one of the highest rating shows on Sunday mornings. And so I had a lot of people call me, and they were elderly-ish, baby boomers. And they called me and said, I saw you on, you know, the Cynthia Hardy show. I hear what you're doing. I love it. How can our community be on board? And that was just amazing to me. I had about 3 or 4 calls, and that was enough for me to be just really excited, right? So TV is huge for that demographic. Now for social media, I mean, for younger demographics like millennials and Zs, some Xers, yeah, it's going to be social media. So I created a social media, a Facebook in coronavirus group. So it's called In Coronavirus SC. So you all can join it if you're not on it already. I know Gary's on it, and Katie's on it, just so I can see like the conversations that are going on in South Carolina. But I got about, gosh, 522. I kind of look at it every day to see how many people are on it. 522 people on that Facebook group at this time. But I want it to continue to grow. But I think that's a good audience to start plugging our information in. And the purpose was to get people together who care about, you know, coronavirus, like getting rid of coronavirus, and to care about like what they can do in order to get to 0 cases. So once we start our community-led action, which will start next week, we'll start pushing out like action steps for people to do on that In Coronavirus SC Facebook group. We chose Facebook, and yeah, we chose Facebook because it's the best advocacy tool that I know of so when it comes to social media. Twitter is great for, Twitter was great for like presidential campaigns. It's like, it just depends on what you do. Like Twitter, I don't use Twitter other than like for presidential stuff, because you're reaching a wide range of people. But when you're talking about community, Facebook is pretty much more of a community advocacy tool than Twitter or Instagram. I mean, Instagram is fun. And I think like the Generation Z, if you have like a social media challenge, something like that to help get information across, I think that would help on Twitter. I mean, on Instagram, but primarily to get people engaged and involved in what you're doing, I think Facebook is the best tool for that. You know, if you're reaching the Gen Xers and the Zs and the millennials. So that's pretty much what we're doing for information sharing right now. The Facebook group and then some local media. And we'll be increasing that when we do our community-led action. What we're going to do is a press release. So then it will be more press that or more media opportunities. The media opportunities we got so far were just people who knew I was working on coronavirus response and wanted me to talk about what that was. So it was great to have the earned media, but now we're going to be actually pushing for media after we get, kickstarted with our efforts here in South Carolina
All
next week.
right. There's some exciting developments and there are a lot of channels. And so if someone's thinking about doing a bit of advocacy, pick your favorite channel. Like if you like radio, then call into your favorite radio station and just like be like, hey, this is a bit about in coronavirus, and see if they'll put you on. They might. If it's interesting, they'll put you on. If you have a newspaper that you read, write into the newspaper and give them like an op-ed. They're looking for material that's pre-written that they don't have to write themselves, so they'll be glad to publish oftentimes. If it's social media and you use social media a lot, use your social media channel. Build a local community network on your social media for advocacy. If it choose what is comfortable for you and get it done. It's it's really easy. It's difficult because it's a grind, but getting started is not like a Herculean task. It can be very, very simple actions, and those actions can compound and build momentum that can lead to real change. So it's very exciting to see that the work that you're doing, Tiffany, in South Carolina is really starting to spread out and build an impact. That's very cool to see. Joaquín,
thank you.
Tell us a bit about what you have done and maybe some of the Spanish speaking side of that.
Yeah, sure.
Then we'll get to the questions.
Sure. So, early on, it's really an interesting thing, right? So, early on, for those of us who, saw what was going on, saw that, coronavirus was a problem, going to be a problem, saw the government's response and saw how far it was from an adequate response that we needed. Eventually, we all took ownership and decided to take action and take things into our own hands, right? And so, one of the things I saw in my own community is that I saw the challenges for, English speakers on coronavirus. So you can imagine the challenges for Spanish speakers, right? Because there's always some lag or they don't have the information available. And I saw recently, Spanish television was on and they had some celebrity who was taking some type of like Clorox and said that it had helped her. And I'm like, oh my God, why is this being shared out there? Horrible and potentially deadly information. And so, early on, I did some videos in Spanish just to share the information I had at the time, right? And, the information I had was that, this is very contagious. And it was when, the first studies came out on aerosols, right? And that, pretty much if you're sharing the airspace with somebody, you can catch the coronavirus that way. So I did one video with my dad, did it in Spanish. We could have been further apart. I think we were probably like 4 feet apart, but he's in my pod, so it doesn't really matter. But I put some caption to show that we should be 6 feet apart. But just sharing in Spanish that, hey, you have to have distance with people, because the way you get this is through sharing the air with others, right? And I did that in Spanish, and I put out I believe another video in Spanish, and so but that's a huge challenge, and you see how big of a challenge it is when you look at the numbers. I recently looked at the numbers comparing unincorporated East LA, which is primarily Latino community, compared to Santa Monica, and you have about 5 times as many cases in unincorporated East LA. That's crazy, right? And there's several reasons for that. But, you know, some of it is just information, you know, some of it is just these socioeconomic conditions that exist there as well, right? That's where advocacy comes in too, right? It's just, you know, we can share all the things you have to do, but hey, if you have a job where you have to go to, you know, you work at a grocery store, I mean, you know, grocery stores are a vector of transmission, you know, it's indoors and there's a lot of foot traffic there, you know? So some of it, so that's where the advocacy piece comes in. You know, part of our strength too is that we all have our own audiences, right? So, you know, it's good to share other people's information, but, you know, as Gio was saying, as Tiffany was saying, if you provide your own information too, you have an audience that wants to hear what you're talking about because they care about you, okay? They care about you and they're listening a little bit deeper than some random video, some random article, you know, and that's why, you know, a couple months back, I started doing some videos with Jeremy, just based on this idea of, hey, you know, I've been wanting to do some videos just to help my own community. And so, you know, decided to do a video just on coronavirus transmission, and then another one on coronavirus in the summer, you know? And so I encourage everyone to, you know, just do your own videos, you know, do your own videos or write your own Medium articles, you know, collaborate with people, because, you know, I think that has a significant impact on the people in your circle. And then, yeah, just, you know, there other channels are just, I'm building inroads with the, with a day labor organization, which is very underrepresented, probably most underrepresented, you know, people in our society, right? And so they have their own radio station, and so hoping to, you know, get some more information sharing done that way. But, you know, every channel you have, every way you can act will make a difference, you know, so use everything and don't discount yourself. You have a lot of value. Everyone has a lot of value. So don't think you're not good enough to share this information, right? So if you're asking the questions, if you're really trying to understand, then share that out there. If there's caveats to the information you're sharing, do that too, right? So you don't have to pretend you know everything, right? You can say, hey, I know this, there's these things I don't know, right? And then bring people with you on that process, right? And in that way, I think you may have some people that get ownership as well during that process.
Thanks, both of you, for covering that. I think there's one last information silo that's worth mentioning, and that's the political one, where I think, you know, my experience with the few times that I've waded in to this, mostly on social media, sometimes with friends, is that there is a decent chunk of the right that is in an information silo where they are concerned about COVID, but have not heard anything credible within their network that gives them any leverageable knowledge. And so just the difficulty of getting credible knowledge that's usable, that can be taken and transformed into action, means that there is untapped potential sort of across the aisle from the sort of traditional lines that are cut in politics. I know that one of our early team members, who I worked with quite closely, was part of Trump's campaign staff at one point, and he reached out to a lot of his networks and got some got some real feedback and shifts in some opinions of some relatively meaningful players on the right early on. And so there is potential there, even though the politics have kind of fallen apart, for like real impact, because people who are in a different political silo know how to communicate with that silo. So if you can build a personal connection with somebody and share information, solid, reliable information, and do it honestly as more of a friend than of somebody trying to get a political win, that person can take the knowledge you give them, transform it into the language of their, like their circle, their community, and that can have a real powerful impact. And so there's so much potential just, you know, approaching this like as a single person. If, you know, you just grind it a little bit. So on to questions. One thing I have always wondered, do those change.org petitions actually work? So do either of you have experience with this and could comment on it?
Have you worked a lot with those, Tiffany? We can't hear you. I think you're muted.
No, I have not worked with change.org petitions. I've signed a bunch of them. How about yourself?
Well, so the way I see it is that if you can, you can leverage them, right? So you can leverage them into, you know, a press release. You could leverage them as part of the advocacy that you do, you know, with legislators, and to show that, hey, you know, so many people support this cause. I think on their own, you know, it's just like another piece of paper, right? You know, you know, what matters is the actions that are taken upon, you know, after that, you know, paper exists. So I think in that way, they are helpful. Just getting signatures by themselves and thinking your job is done, you know, that's not how it works, right? It's a nice milestone, but there is strength in that, right? And so you got to use that in a way that helps your cause, right? So, you know, it's part of the messaging, right? If it's in the news, it's you know, 500,000 people sign this petition, you know, to have masks, right, in whichever state, you know, that type of stuff is powerful, right? So I think they can be effective in that way.
All right. I think the big question, before Tiffany, before your time is up, and you can stay as long as you want, but I know that an hour was the time that you were set to give us, and we're right at that. What are the top 3 things that individuals can do in terms of COVID advocacy?
I think the number one thing, see if am I on mute? Okay, no. The number one thing a person can do is practice what they preach. So I think being a walking billboard is just that is just what you have to do. And I say that because not everybody is like 100% like doing the right thing, right? There's some people who are, but being somebody who is trying to preach the proper way to social distance and to wear a mask and to, you know, just stay safe. I don't want to be caught at a bar with my friends with no mask on and a picture is taken of me on social media, and then I'm given a conflicting message just by, you know, somebody posting a picture of me with my friends at a bar and no mask on. Now, it looks inviting when my friends post them doing that, but I'm not going to go do that because I know what message I'm trying to get across, and I have to be true to what I am. As true as I can be. As true as I can be to what I am trying to get others to buy into. So I think that's like the top thing that you can do. The next thing is reaching out to your family and friends. And I like what Joaquín said about sometimes, you know, the people you think that's going to be on board with you are not going to be on board with you, right? But I think that the ask is just important. You have to do the ask, right? And I think that's half the battle, because you just would never know. You would never know if you don't ask. So I would start with people who are close to you. Just do the ask. Say, hey, this is what we're doing. This is the community action that we're doing. Can you get on board? If they say no, then ask them if they know of anybody who can get on board, right? And that's a part of like relational organizing too, because some people will say yes. And the people who will say yes, you can have them organize their relationships and just say, hey, well, it just so happened, I'm a Mason and I'm a part of, this church, and I'm a part of this organization, and I do this. I can, organize my own relationships. So I think doing the ask opens that up for people to have the opportunity. You can't give people the opportunity if you don't do the ask. So number 1 is practice what you preach. Number 2 is the ask. And number 3, I will have to say is, there's probably several others, but I'm going to say this because this is something that I am working on. It's the follow through, right? It's the follow through. So if you're getting people on board, then retaining them, keeping them interested, keeping them involved and engaged, and giving them ownership. Because once somebody has ownership of what we're doing, then they were taken on for themselves, and you don't really have to give that much direction when they feel like they have a stake in what we're doing. So that's the 3 things I would say.
All right, thanks, Tiffany. All those were really great advice. The one that especially stuck out to me was the practice what you preach bit, and especially the as you can be. Like, one of the things that gets to me especially is the puritanism about this that gets thrown around, and it's like, I want to be 95% good, and for the rest of society be 95% good, because being 100% good is a pain. I don't want that. It's miserable. It sucks. I want it to be 95%, because if we're all 95%, we get the R effective, the spread rate of the disease below 1, the disease goes away and we're done. And that's what I want to do. I don't want to be keeping myself safe in perpetuity. I know how to do that. I do that, for the most part. I want to be safe while living a normal human life. And for that to happen, society has to do this together to solve the disease. And that is, I think, like a really, important part of it is, it's not about being perfect. It's about being good enough together to stop the disease.
Absolutely. Good enough together. I like that. Yeah.
All right. Another question from the chat. Oh, actually, Joaquín, your top 3. I almost missed that.
No, I'm all on board with those. Those are perfect. I think, I think just key is just empowering. Advocacy is really about empowering, right? You can't do it on your own, right? And so, and it's not about, one of us or just being the one that makes it happen, right? Just think about it, as everyone is going to make it happen. So help them be effective, right? Help them get things done, right? That's key, right? Because if you do that well, they're going to be able to do that with someone else, right? And so this is eventually this is key to community organizing, right? It's that you empower others, and they, if fully empowered, will then empower other people, and this is how you grow, and so I would just, as one key point there is just empowerment, right? How can I empower this person, right? How can I empower this community, right? if you know, and how can I empower them? You know, how do I give the most value that I can give, you know, to what they're working on? You know, that's what I try to ask myself whenever I'm doing something, right? How can I give the most value here, right? And with you know, something like this, you know, like you said, if everyone is working on this, you know, doing good but good enough. What was it? What was the phrase?
Good enough together.
Good enough together, right? Good enough together. If you're doing good enough together, you know, you know, the together part is where you empower everyone else, right? So that's it. You know, just focus on that, and eventually it'll get there, right? And then you just have patience, right? Have patience, because things are not going to go the way you want all the time or that you expect. And again, this is part of the process, right? You know, there's a lot of things, you know, and then some things will go beyond your expectations, right? And those are awesome. Those are huge wins, right? And so celebrate those too. But you don't know unless you keep trying, right? So try, right? Make the ask, follow up, you know, just keep going. That is key. Keep going. And as a community organizer, what happens with community organizers is that they give a lot of themselves. So if you need some time, take a step back, take a breath, you know, take care of yourself. If you need to go into nature, you know, if you need to just lie down, do meditation, whatever you need to do, very, very important. Okay, because this isn't a month campaign, right? This isn't like, hey, in November, this is over, right? Unfortunately, this is a very big situation. People need to keep doing work, but they also, in order to do that, they need to take care of themselves, right? So, you know, don't feel that you need to show up all the time. Sometimes you need to take a step back, you know, and you need to be able to recharge, and that is good. Okay, that is good, and that's going to help you be long-term effective.
Thank you. So it looks like I got 3 out of both of you.
Yeah.
Awesome.
Okay. There you go.
So are there some advocacy actions that might seem impactful upon first glance, but end up having very limited utility, maybe especially with the COVID situation versus sort of advocacy tools overall? Like, what are tools that are more effective with COVID or less effective with COVID than one might expect?
Tweeting
It
can be effective sometimes. Like sometimes there's like a whole PR campaign, and you know, sometimes there's like an organization behind it. Sometimes it's organic, but you know, sometimes it's kind of like in the void. You know, it's like, hey, like, you know, so maybe that is one, just off the top of my head.
Oh, wow. That's a good one. I can't think of another one, but tweeting is a good one.
All right. Listening anyways. What? 61 impressions? That's all right, I guess.
Right. Yeah. I don't know. I can't think of another one right now off the top of my head.
Yeah, the more personal approach seems to have been the most effective from everything that I've seen. You know, so that's the kind of like Twitter's to some extent impersonal, just like broadcasting into the void, as you put it. And the personal touch seems to be where the progress goes. So let's see if we have any more questions in the chat. Yeah, so do we have any success stories or proud moments that you'd like to share, Tiffany, that we haven't already gone over?
Gosh. It's I have proud moments. I don't think I had like one big, like, you know, I think my moments come every time somebody says yes. Every time someone says yes, I am just over the moon. So yeah, I don't have a proud moment I can just pinpoint. It's just the moments the moments that somebody comes on board and that they're helping out and they're bought in, that just makes me just thrilled. Because I know it's a domino effect after that, right? Just a couple people say yes, then the people that they know will say yes, and that just makes me really happy. So I mean, I don't have like a moment. I don't know. What about you, Joaquin?
Yeah, there's a couple moments that just stand out. One of them is ECV related. After the first training, well, during the first training, Briggs was a part of the training, and she asked the question, and she said, so you're telling me that if I set up a meeting with this person that I know, that's part of the community colleges, or that runs the community colleges, and I bring Yanir on board, that he'll have a meeting, and I was like, yes, and that happened, and she also asked that like it helped to provide a meeting to the mayor, and that happened, and it was just like, it's really cool because it was just like, in that question, it was kind of like sort of like a vision board, right? So you're saying, if I do these things, right, and then you see it actually happen, and then to see the great work that's been going on in Arizona and the inroads with the mayor there, like that's a really cool moment to have been a part of for myself, and to see Briggs, continually, follow through and hit it out of the park, right? And challenges come up, but she keeps going. So that's one thing. And then just personally, just here in LA County, one of the first things I did was to, I saw the PPE shortage, so I was like, well, I'm just going to do a GoFundMe, raise some money for masks, and I eventually raised the money. It's harder than I expected. Everyone should just give money, right? It's like important, right? But whatever, you got to work hard on that. And then I had a supplier. That supplier fell through, and then I had to find another supplier. Eventually, I found one, and it came from somebody who really appreciated the work I was doing early on sharing about coronavirus, right? Mm-hmm. And so he's just been super helpful. And it turns out, he became a supplier for masks, and he really vets these masks, so they're really good masks. And so, he helped me get, the masks for the funds I raised. And so we managed to get over 1,000 masks to LA County hospitals. And in that process, someone introduced me to a doctor there. And so she's get me informed on everything going on there. And, we're in the process of her connecting us with the administrators there in order to hopefully get CT scans. That's still, a slow process, but, it's kind of like, it's all intertwined, right? So, you try and do good, just it ends up just working to create more good in ways that you did not expect, right? And so even though, again, there's challenges in the process, you just got to go through the challenges, and eventually, good things will happen.
Yes.
Awesome. Just start working on it, and it will happen. And then also massive shout out to Briggs for all the awesome work that she's done locally in her community. It was one of the big breakthroughs that we had as an organization that kind of kept me with a kernel of hope, at least, when I was the most beat down about the way that this whole pandemic was going. To see that somebody who I knew and worked with was having just explosion of success. So it's big shout out. Thank you, Briggs, for just working on it. Tiffany, Joaquín, thank you both for showing up and giving us your time. Is there anything else that either of you would like to share before we wind down? tonight.
I don't know if I have any closing remarks. I would just say, like, if you have any questions, reach out to me on Slack, email me, and whatever I can do, I'll be happy to help. I'm right now, like, we're trying to launch this thing in South Carolina, so it may be a little hard to get in touch with me, but yeah, I'll be happy to help in whatever way I can. And actually, once we get more volunteers in South Carolina, whatever I can do to help you all out where you're at, I would love to. And I can also look into see if I have any connections anywhere else, like in Arizona or in any other place that we're doing community building. I can look into my contacts and try to help just with your efforts. So that's about it. That's all I have.
Thank you for having me. Thank you for including me with Tiffany. I'm inspired by all the work that Tiffany is doing. It's a lot of work. It's a lot of work. But it's necessary, and to have a champion like Tiffany making huge progress in South Carolina, I think that's going to be a model for a lot of other places around the United States for sure, and maybe even other parts of the world, I expect. So I just on my part, just keep going, just keep going, ask questions, and try, in the process of trying, it is helpful to reflect too, to see how you could have done something better, maybe some information you could have had too, to help you in your communication, right, of COVID, or maybe there's, there's part of the legislative process that you maybe had questions on, or maybe, there's a lot of work that ECV is doing, right? The CT scans, isolation housing, right? Maybe there's details in that, right? That when you're communicating with other people, that you find yourself that, hey, I have questions on this, right? So use endcoronavirus.org as that resource, right? To find this information out, right? Again, ECV is a resource, right? It has a goal, right? The goal is to end coronavirus, right? And the way we do that is through this amazing group of people that really care, that really want to make a difference, and that are working really hard, and that have incredible talents and incredible backgrounds. And so, just use this place as a resource, and at the same time, look at yourself as a resource, and provide what you can to everybody else. And I know it gets tough. I have my moments where I'm feeling really beat down, and that's okay. I take some time for myself. I regroup, and then I keep going, So if you're feeling like that, that's okay. Take your time, and then just keep going.
Yeah.
All right. Thank you both for this excellent talk. I really enjoyed this. I thought that, the upbeat attitude that both of you bring, is inspiring. I know I'm a little bit more inspired after this talk, to just keep grinding. And I hope that the rest of us feel the same way. I know that I've seen that in the chat. We've just had kind of an outpouring of enthusiasm, really. So just thank you again for giving your time and for being kind of guiding lights full of positivity and energy, driving this whole outreach effort forward. It's very important. So thank you.
Thank you.